Ladies and gentlemen, welcome to the journey of honor, journey of pride, and journey of celebration with Brand Icon presenting International Excellence Award 2018. On 28th evening, get ready to dress up in the shades of dark as it is night to be get honored.
The next award.
Ladies and gentlemen, we welcome you all to International Excellence Award 2018.
So thank you for having me. I'm really honored to be presenting these awards. Thank you, Brand Icon, for inviting me.
The best homeopathy clinic in Bangalore, and the award goes to Amrita Homeopathy. Can we have Dr. Sanjay Panikar?
Yes, can we please hear it for Malaysia, everybody, and International Excellence Award, and the whole team of Brand Icon.
Congratulations.
Sir, we're more than obliged for this great moment to happen to all of us, and yes, it's going to be Malaysia.
Hello, I am Dr. Sanjay Panikar. I founded Amrita Homeopathy in 1997. We are placed in two locations, Koramangala and Marathali. We specialize in hair and skin problems, respiratory problems, pediatrics, allergies, and infertility. Anti-malarial medicines are actually not to be taken with antihelminthic tablets. They are contraindicated. That is an allopathic line of treatment, and hence it would be better to consult an allopath and deal with the problem. A very common question asked by a lot of my patients is whether my hair loss can be reversed. Hair loss is a very common term which is used by common man, and they usually say, I'm losing hair. But if you look at it medically, there are 40 different types of hair loss, and whether it can be reversed or not depends upon the type of hair loss that the person is having, which we can diagnose with help of certain equipments like a video microscope or a hair analyzer or equipments like that. There are biopsies, blood tests, and all those things with which we can identify what type of hair loss it is, and then we can tell the patient whether you can reverse it back or not. Medically speaking, among all the 40 types, we don't get all the 40 types of cases that come to us. The most common type of hair loss that comes to us, androgenic alopecia, alopecia areata, and telogen effluvium. These are the three most common type of hair loss which we come across. Now if you look at androgenic alopecia, it is a condition where the hormone dihydroxytestosterone, which is there in both men and women, comes and attaches to the hair roots on the crown area of the scalp because the scalp becomes sensitive to this particular hormone. When the hormone attaches to the root of the hair, the nutrition what is supposed to reach the hair reduces, and hence the hair starts thinning. Every time a thick hair falls, a thinner hair starts growing, and a thin hair falls, an even thinner hair grows, and eventually it dies. This process of thinning of the hair strand usually happens after 50 years or after 60 years. But nowadays we see even 20 and 30-year-old people coming up with this common type of hair loss where the hair is thinning. This is an aging process of the hair strand, and aging is supposed to happen later on in life. But for some people, due to various lifestyle and reasons and hormonal problems and so many things like that, we get these conditions happening earlier. Now here in medical science, two things is irreversible. One is, if I become old, I cannot become young. Once there is death, the dead tissue cannot be restored. And once a person becomes old, he cannot become young. The same rule applies to the hair. Once the hair becomes old, it cannot become young. Once the hair dies, then you cannot bring it back to life. There is no way you can do it. So in androgenic alopecia, which is a process of hair aging, after it ages, it dies. So once it dies, then you cannot bring it back to life. Once it ages, the thick hair what you have on the scalp can become as thin as what you have on the body, as small as the hair which you have on my hand now here. So this type of very small hairs are also seen on the scalp as the scalp hair becomes thinner and thinner. So once it becomes very old like that, you cannot make it thicker. There's no way you can do it. Once it dies, you cannot bring it back to life either. So in this condition, it is irreversible. You have to arrest that particular process with treatment, and the hair which has just started aging, we can improve it, but the hair which has become old, we cannot. Whereas in the other condition like telogen effluvium, it's a common condition seen after pregnancy, after delivery, when women start losing a lot of hair, or maybe after a major illness like typhoid, malaria, jaundice. After antibiotic, people lose a lot of hair in bunches. If I touch the patient's hair, I get 10-15 hair in my hand. So that is telogen effluvium. In this particular type of condition, you lose hair from all over the scalp. It's not specifically from the crown alone, it's from the entire scalp. And when this type of hair loss is there, you can restore it back. Actually, the patients start improving. Many patients improve or restore it even without any treatment. That is called acute telogen effluvium. When it is chronic, when it goes beyond a particular stage, like more than 6 months the person is losing hair like this, then it's called chronic telogen effluvium. And in this condition, we have to interfere and we have to treat it with medication. Otherwise, the person will go bald. The other type of hair loss is alopecia areata. Alopecia areata is a patchy hair loss which comes here and there in patches. In this type, there are two types of hair loss, scarred and non-scarred. The scarred one, there is a scar which forms in the area of the patch, and that scar, once it forms, it's like any other wound scar. There the hair roots are destroyed and hair cannot grow back. Whereas in the non-scarred variety, you can grow back the hair if you treat it, or if you don't treat it also, in some patients it grows back. But if in case these patches start increasing and the entire hair is lost of the scalp, that is called alopecia totalis. The total hair is lost. And some people, even it affects the eyebrows. This is an autoimmune condition. Our own immune system is doing damage to our own hair roots. In such a type of hair loss, medical intervention is required. Otherwise, you cannot restore. Hepatitis B is a type of inflammation of the liver which is due to a particular virus. They say that hepatitis B is incurable, but I have treated cases of hepatitis B which has become negative subsequently. And in my experience, I have seen that hepatitis B in the early stages, we are able to treat it and make it negative. As the disease progresses, the patient moves towards cirrhosis and other issues, then the treatment becomes more and more difficult. But in the early stages, when the test is positive, only few symptoms are there in the patient, maybe even nausea, vomiting, weakness, and all these kind of issues also, we are able to treat it and see that the disease becomes negative. For example, I had a patient who was diagnosed with hepatitis B at the time of her hysterectomy. And then we started off homeopathic medicines. It has been 1.5 years that I have been treating her, and her tests have become negative now. In allopathic medicine, usually the remedy of choice is Silibon or Silimarin. Silimarin is nothing but a plant extract from a plant called as Carduus marianus, which is a common remedy in homeopathy used for treatment of liver diseases. And I have found excellent results in treating hepatitis B with remedies like Carduus marianus, Chelidonium, Chionanthus, and Lycopodium, Phosphorus, Thuja. These remedies I have used in the treatment of hepatitis B, and many of my patients are much better symptomatically. Some of them have turned out to be negative too. So with this confidence, I think we should not get worried that we have hepatitis B. It is nothing to worry. It is a disease which can be treated and dealt with. I have seen some people treating hepatitis B patients as if they are kind of untouchable and things. That is wrong, and that is not so. Hepatitis B does not spread by just touching the person or by contact with the person. It spreads through body fluids and is a sexually transmitted disease. Hyperthyroidism is commonly seen in women, though it can also be seen in men, where usually the men present with Graves' disease. Graves' disease is when you will find the eyes protruding out. There is a stare sign that the person looks as if he is staring with his eyes protruded out. So when you find this group of symptoms and the patient has hyperthyroidism, there is a high possibility that it can lead to infertility, because the sperm count starts reducing, the sperm motility goes down, and also the shape of the sperms, teratozoospermia, is again a very common condition which happens in people with hyperthyroidism. I would suggest not to take alkaline water immediately after any medication for at least a period of 2 hours, because alkaline water hastens the absorption of medication. So we have given a particular medicine with an intended speed of absorption, that the medicine should be absorbed in this much time. And so if the patient consumes alkaline water, the absorption becomes very, very fast, and that can cause unnecessary problems where it is not needed. But at the same time, when you take certain supplements, taking alkaline water immediately can help the supplements to be absorbed very fast into the body. Otherwise, I do not suggest that. Overthinking can lead to headache. Stress can lead to headache. These headaches are otherwise also called as stress headaches or tension headaches. They usually present as pain in the front of the head, on the forehead, the temples, or on the vertex. It's a very common problem. Everybody knows that when you're stressed out, you might develop a headache. And that's why we say that, oh man, what a headache this person is, because he's probably stressing you. And then when you have similar condition, like you're getting a headache and it is due to stress and lasting for more than 20 minutes, okay, that in that case, all that you need to do is take rest. See that you close your eyes, lie down and try to sleep. And in case you are not able to, if pressure relieves, use pressure. If heat relieves, use heat. And then if still not under control, then you need certain medicines which can give you relief. There are excellent homeopathic medicines which can give relief for this kind of tension headaches. Headaches occurring as a subsequent effect of fear, aconite is an excellent remedy for that. If headache is on one side of the head, the left-sided headaches are usually controlled with medicines like spigelia. Right-sided headaches are controlled with medicines like belladonna and sanguinaria. There are so many medicines like this. Headache due to severe stress can also be controlled by a medicine named arnica. There are certain indications on which we prescribe these medicines. The homeopathic physician will be able to help you better during these times. Marijuana or weed. The effects of this remains in the body for about 3 to 4 weeks, and it is totally excreted from the body only in about 90 days. And so many patients do face symptoms like dizziness and this out of the world feeling or feeling a bit high. This can happen in patients who have used marijuana for a long period till it is completely excreted, and after that it stops. Many people I come across who are totally bald or who are in the process of balding, and they tell me that my father is bald, so I can't do anything about it, and so I'll also go bald. Okay, this is partially true and partially not true, because a genetic factor, when it is there transmitted to the next generation, that is when you will go in for baldness. Suppose you have inherited the gene of baldness from your father or from your mother's side. Many people think that mother's side does not come to the child. It's not true. It can come from either sides and they can go in for baldness if you have inherited the gene from one side or the other side, father's side or mother's side. But genetic factors generally become activated usually after 50 years or at 60 years, not prematurely at 20 and 25 years. So if you find that anybody is going bald very early in life, then it is a premature activation of that particular gene for baldness, because human being is made in such a way that you are supposed to age, and balding is a sign of aging. Aging is supposed to happen after a particular age, after 50 years or after 60 years. But if you find this aging process is happening prematurely, as it happens in some people, it is because of so many other factors which has triggered that gene, and so you're becoming bald earlier. So in such cases, this premature aging process can be arrested with treatment, and we can see that the person doesn't become bald at a prematurely young age, and we can see he goes in for baldness later on in life. Nowadays there are so many techniques like mesotherapy, wherein the patient can restore the hair even after within just a short span of 2.5 months or 3 months. The patient starts improving. I have wonderful cases where the patient was actually deteriorating, and in just 2.5-3 months we have restored the hair of that patient. So this is possible in today's with the advancement of science and technology. This is a French technology which we have brought into India, and we are treating patients with this. If the genetic factors are there, baldness is inevitable to come even if you treat it, but later on in life. So whatever that good age of your lifespan is there, usually 20 years, 30 years, 40 years is supposed to be the good golden age of your life. So at that age, if you treat it, you can see that you retain your hair, but you will go in for baldness if you have a gene by 50 years or 60 years. You can postpone that aging process. You can postpone the deterioration. There are wonderful remedies in homeopathy to improve the thickness of the hair, but we have a specific approach based on each individual's problems. In the sense, it is a holistic and individualistic medicine. What medicine I may give for one person may be different for another person. So it is based on the particular problems that the person faces and understanding the root cause of that particular person that we treat to improve the hair volume. In general, there are 40 different conditions which can cause hair loss. So if you identify the cause and then treat it, then basically it can be corrected. The most common remedies that are used for treatment of hair is Wiesbaden, Jaborandi to increase the hair volume. Also we have medicines like Sabal cerulata, Thuja, Natramur, sulfur, Surinam, which can be used to improve the hair volume. More than that, in androgenic alopecia, where there is a block at the root of the hair, the nutrition to the hair is what is not reaching the hair because of dihydroxytestosterone, which blocks the hair follicle, and so the nutrition is not able to reach the hair. In such cases, with homeopathic medicine, within about 3 to 6 months, usually the improvement starts because this block starts getting cleared. That is, the sensitiveness of the scalp starts reducing, so the nutrition to the hair reaches back, and then the patient improves. But since it is of a longer duration, we have come up with new techniques where we can improve the hair volume within a very short duration, like just 10 weeks. What we are doing is we are applying high protein serums on the scalp. We are using certain instruments to massage the scalp. With this particular instrument, the scalp becomes warm, the sensitiveness of the scalp remains same till the homeopathic medicine corrects it, but before that itself the volume picks up, because every week this procedure is done for almost an hour, and when you do this procedure every week for 1 hour, then within 10 weeks of feeding the hair regularly, the hair volume picks up. But how are we going to sustain this growth? The sustenance of the growth is only possible if this block which is there at the root of the hair is cleared, and this block is cleared with homeopathic medicines. So this combination is producing drastic and very fast improvement in the hair volume in young and elderly alike. In Bangalore, Arthritis is nothing but inflammation of the joints. Inflammation means it is characterized by redness, swelling, stiffness and pain. So wherever in the body there is inflammation or redness, and if the joint is affected, then it is called as arthritis. Arth means joint, itis means inflammation. Very often patients get scared by hearing arthritis. Arthritis is no major term, it only means inflammation of the joint, nothing else. There are different types of arthritis. What type of arthritis is very important, because even the homeopathic treatment is based on the type of arthritis. There are arthritis like rheumatoid arthritis. There is arthritis like gout, which is a metabolic arthritis where there are some substances in the blood because of uric acid. There is arthritis which can come on from infection. There can be arthritis which can come on from injury. There can be arthritis which can come on from overuse. Like for instance, I had a patient who was using the laptop too much and then he developed arthritis of the fingers. So there are different types of arthritis. If it is due to a mechanical reason like an injury or because of overuse of the hands or the legs, then it is easier to treat this particular condition. Medicines like arnica, ruta can be used in the treatment. Symphytum can be used in the treatment of mechanical injury resulting in arthritis. But if it is some condition where arthritis can also happen because of autoimmune, that's our own immune system doing damage to the joints. And in these autoimmune arthritis, that is the most difficult type of arthritis to deal with. And you have conditions like rheumatoid arthritis, ankylosing spondylitis. These kind of arthritis are a little difficult to treat, but not that we have not treated. So many cases are there where RA positive patients I have where we have been able to.
Ladies and gentlemen, welcome to the journey of honor, journey of pride and journey of celebration with Brand Icon presenting International Excellence Award 2018. On 28th evening, get ready to dress up in the shades of dark as it is night to be get honored.
The next award.
Ladies and gentlemen, we welcome you all to International Excellence Award 2018.
So thank you for having me. I'm really honored to be presenting these awards. Thank you, Brand Icon, for inviting me.
The best homeopathy clinic in Bangalore, and the award goes to Amrita Homeopathy. Can we have Dr. Sanjay Panikkar?
Yes, can we please hear it for Malaysia, everybody, and International Excellence Award, and the whole team of Brand Icon.
Congratulations.
Sir, we're more than obliged for this great moment to happen to all of us, and yes, it's going to be Malaysia.
It negative. I have patients with ankylosing spondylitis who have been able to manage for so many years without steroids, and I have patients with conditions like gout where the uric acid has become normal without xyluric and other allopathic medicines. So here we are correcting the basic metabolism of the body, correcting the functioning of the body, seeing that the biochemical functions in the body are restored back to normal, and thus the problem is getting corrected. There are medicines. Most common medicine any homeopath would use is Rustox and magnesium phos. These Rustox is nothing but a plant extract, and magnesium, as you know, is a mineral. Phosphorus is also a mineral. Magnesium phos is a combination of that, which is again used to relieve pain. So these medicines are very commonly used in arthritis. There are so many other medicines like causticum, you've got ledempal, you've got symphytum, you've got arnica. These kind of medicines are also used in pain relief. Again, if the inflammation is very acute, we even use belladonna as one of the remedy. Bryonia is another major remedy used in arthritis. But all these are superficial remedies which can work at that particular sector. But if we want to cure this disease entirely from the root, then we must identify what is the cause of the arthritis, what is the type of arthritis, and what is the reason why this person has developed this particular issue. Very often people with arthritis, we find that they are under a lot of stress. Emotional stress has its impact on arthritis. So it's important to understand that, correct that emotional factor, and see that the body adapts to that emotional situation. It's the adaptation which is more important. There are homeopathic remedies which helps the person to adapt to that particular situation and come out of the arthritis. So there you need to go for a detailed case analysis, understand that particular person's nature, personality type, stress levels, how it is connected with the problems that he is having. This particular link has to be established, and then we have to prescribe for him in a more deeper way. Then only you can eradicate these kind of problems. When you treat dandruff homeopathically, it is important to identify what kind of dandruff it is. And thus, we need to know what are the types of dandruff that we get on the scalp. Dandruff is nothing but excessive multiplication of the skin cells in such a way that it forms scales. Normally for everybody there is a little bit of shedding of the skin on a day-to-day basis. When the rate of shedding increases, that is when it piles up and forms this dandruff. Dandruff can be of two types, dry dandruff and moist dandruff or sticky dandruff. Dry dandruff, usually when you run your fingers through the hair or when you comb, you find the powder falling onto your dress. The moist or sticky dandruff usually can only be scraped out with your fingernails. Because of the oiliness of the scalp, the scales of the skin get stuck onto the scalp itself. Now, as far as the diagnosis is concerned, the most common condition that we come across in dandruff is seborrheic dermatitis. Here what happens is there's a particular organism called as Pityrosporum which is growing on the scalp. It is there everywhere in the atmosphere, but it does not grow on the scalp if you have a good resistance to that particular organism. But here in some patients we find that the internal resistance to this particular organism is not there. You can use any number of shampoos which is available in the market which contains ketoconazole or anti-dandruff components in it so that it can kill this organism. But you find that it keeps coming back. Today you wash with an anti-dandruff shampoo, by evening or next day again it comes back. So they say that once you get seborrheic dermatitis, it doesn't go all your life. Seborrheic dermatitis we can identify if we look through a wood lamp. You can see golden yellow flakes on the particular light, because this particular light absorbs, when it is focused onto the scalp, the organism absorbs this light and reflects in a golden yellow fluorescence. Pityrosporum is the organism which is responsible for seborrheic dermatitis. There is one more condition very similar to seborrheic dermatitis, but a little more severe type of dandruff, where people often come up with dandruff either in patches or the whole scalp getting covered with dandruff, and this is called as psoriasis. Here you find that the scales are excessive, thick, and can be pulled out in sheets. So this particular condition is because of your immune system not able to identify that your scalp is your own part of the body, and instead it attacks your own scalp. When there is an injury to the skin cells of the scalp, the cells nearby will multiply and form scales, and that's how the psoriasis can happen. Between seborrheic dermatitis and psoriasis, there's one more condition called as sebopsoriasis, where you have a little bit of sebum which is being secreted and the organism which is growing in that sebum, and you also have psoriasis like patches on the scalp where the organism is not there, just the immune system is doing damage to the skin, and so the scaling is happening. So all these conditions, the prognosis, the rate at which it may improve or the speed of improvement varies, and hence it's important to know what you are treating. This problem increases in rainy season and winter season, all these type of dandruff, because in rainy season or winter season the dryness of skin increases, and also the immune system starts thinking that okay, it should protect the body, and so it releases lot of immune cells which is supposed to attack bacteria and viruses. But in the process, it is identifying your own skin as a bacteria, and it goes and does damage to your skin, and hence the scaling increases in rainy and winter. So when we treat this condition with homeopathy, we have to see that the immune system becomes normal. The ability of the body to recognize that this is your own body, this is bacteria, this is virus should come back. So when we treat it, suppose I give medicine for about 3 months or 6 months, and let us say today if your body is producing some 100 abnormal immune cells, and I give medicines, say at the end of the treatment you see that this year in the rainy season only 50 abnormal cells are released. So the severity of the disease would be better. Subsequent winter, when I'm continuously treating it, only 25 abnormal cells are released. The severity of the disease comes down. Like that, eventually you reach a stage where there is 0 abnormal cells released, and the body is releasing all healthy immune cells which can identify that particular organism and protect. In such a stage, we find that the problem does not come back in the rainy and the winter. One rainy, one winter you don't have this problem, then we usually stop the medication and tell the patient to be just on observation. So this is how we treat seborrheic dermatitis, whether it is sebopsoriasis or psoriasis. Immune system correction is what is primarily done. There are a lot of medicines which are used for the treatment of this, like the most common medicines that is used in treatment of these conditions are Calisulf, Mesarium, Calendula, and you have even medicines like Sorinum, Lycopodium, Sulfur, and a lot of medicines like this. Very often minerals or plant extracts are used in the treatment of these conditions. So there is nothing wrong in taking a shower and taking a bath when you have a varicose ulcer, an ulcer on the leg. Varicose ulcers are small ulcers which is formed in the skin because of discontinuity or a small wound which has appeared on the inner side of the leg just above your ankle, or on the outer side of your leg just above the ankle. So when these ulcerations happen and you wash your body, all the dirt can come and accumulate in the wound, and so the healing becomes difficult, and hence after the shower it's important to specifically wash the wound too. After that, clean the area properly with medicines. A combination of calendula and hypericum can be used to wash the area, not directly, but calendula mother tincture and hypericum mother tincture, 5 to 10 drops in about a glass of water, can be used to clean that particular area on a regular basis, morning, afternoon, night, or morning and night, and then that itself helps many cases to heal. There are other medicines which can be used for these kind of ulcerations, like we have medicines like Vipera, which is very good for varicose ulcers. I have patients who had blocks in the deep veins which have been cleared after we gave Vipera to the patient. There are also other medicines like nitric acid, Merxol, which are excellent in the treatment of ulcers. Arsenicum album is again a very good medicine in treating ulcer. Sulfur is a good medicine. Tuberculinum. I had a patient with such very bad ulcer that it was not healing. He was diabetic and none of the medicines were helping him with allopathic, and he was going on with the ulcer which was going deeper and deeper. There were literally maggots in the wound. Worms were there in the wound, and we had to clean that area and pull out the worms with the tweezers. It was so bad that it just couldn't go near the patient because of the bad smell. And this particular patient, we had given pyrogen, which is an excellent medicine to clear this. So with pyrogen, Heparsulf, and certain other medicine like gunpowder, we have been able to clear this ulcer, and the wound healed for the patient in 6 months. So this is how homeopathy works in varicose ulcers, and sees that you can completely cure it without using any antibiotics, or where even the antibiotics and things fail, homeopathy comes into place. It's very common in children to have frequent cold, cough and fever. If a child gets an attack of cold, cough or fever maybe 2 to 3 times in a year, it's considered to be normal. But if it is happening very frequently, more frequent than that, then it requires medical attention. Parents get often worried that the child's temperature is going high beyond 102, 103, and some of these infants can even develop febrile fits. Parents get worried and rush the child to a doctor. The doctor often puts the child on some antipyretic or on some medicine which can bring down the temperature immediately, and then also gives some kind of medicine like frisium which can prevent febrile fits. Then you can also start them on antibiotics which will kill the organism and prevent the infection, and then bring down the overall infection in about 3 days time. But in the process, whenever we give an antibiotic, the antibiotic kills the organism, the immune system is dormant. So over a period of time, the child's immunity is gradually failing to recognize which is a bacteria, which is virus, and it needs to attack that particular organism. The recognition is not being developed. So what happens? The immunity starts going down. The child does not develop an immune system which it should develop, and in the process repeated infections keep happening. So the only way that we can control this problem is to build up the immunity. Allopathic medicines have medicines like Montec LC, which can be used to improve the immune system to some extent. But there are wonderful medicines in homeopathy which can actually work like your vaccinations. Some of the vaccines are an excellent success in the prevention of various diseases. For example, polio virus is being controlled to a great deal with polio vaccination. All of the vaccines, though, are not that successful. Yet in homeopathic medicine, if you can actually identify the type of constitution of the child, we can develop the immunity of that particular child. For example, I had a child who was getting frequent cough, cold, fever, breathlessness, and it used to keep happening every 2 weeks. In a month, at least 2 to 3 times the child is sick. Every time a course of antibiotic, and again after a week the child is again falling sick. How many times can a child take an antibiotic course? Each time an antibiotic is used, the intestinal flora is destroyed, and in the process the child is becoming weaker and weaker, the absorption is going down, assimilation is going down, and hence it is important to build up the immunity the right way. Homeopathic medicines can gradually build the immunity. Within 3 to 6 months of taking a homeopathic constitutional correct medicine, the immune system starts developing. Whatever defective immune cells are circulating in the bloodstream, as long as they are surviving in the blood, the immunity is not completely developed. But within 3 to 6 months, as the immune system starts developing, the frequency of the attacks start reducing. And eventually, when you're continuously on medicines and the whole immune system is replaced with healthy immune cells, the entire immunity of the child is built. Usually, these problems increase mainly 4 times in the rainy and the winter season. So we monitor it over all the 4 seasons of the year. Summer, winter, spring, rainy of this year is compared with the summer, winter, spring, rainy of the next year. This year how much problem the child has when he is on homeopathic medicines, next year he won't have as much problem. So the immunity is developed over a period of time. That is how the child's immunity can be developed with homeopathic medicines. The mental and physical growth in toddlers is usually measured in terms of weight and the height in physical matters, and in terms of their milestones in the mental matters. Like for example, the height usually increases by about 3 centimeters every year, or by about 3 kgs every year. So this has to be monitored, and if it is not, then probably you should also think about the nutrition, whether the child is eating sufficiently, whether what he is eating is getting absorbed, whether his activity levels are much higher than what he is taking in as food, and so all the energy that is being consumed is being spent out. So these possibilities should be considered. And the mental growth part, whether the milestones are happening on time, whether he started talking properly, whether he is able to interact socially at 4 months when the social smile starts off, whether he is able to do that properly. All these parameters which helps us to assess whether the child is mentally growing at a normal rate should also be checked out. And then you must possibly rule out the conditions which can lead to a delayed milestone, which can be genetic also. Otherwise, the most common thing that you must look into is nutrition. See that he's absorbed, the food that you're giving is sufficient, high protein food, good nutrients, and then see that the absorption is happening properly. A lot of parents do stuff in their children with different kind of food, but the child does not put on weight. The reason is that the absorption is not happening, the assimilation is not happening, and so the growth does not happen. In such cases, there are excellent homeopathic remedies which can help the absorption, assimilation to happen properly, and hence the child growth is much faster and healthier. Usually, in cases of severe cold, flu-like symptoms are seen where there is heaviness and congestion in the sinuses, causing the person to feel heavy-headed, and there can also be dizziness. Most commonly, the dizziness that is seen is postural, like he suddenly gets up from his seat and he feels dizzy, or is lying down, sits up and he feels dizzy. So this is the usual presentation in patients with acute cold, and they have a lot of dehydration, so the dryness of the mouth and other symptoms can come up. So now when you're on medication, you will notice that these symptoms will improve. Usually in allopathic medicine, they use some antibiotics, or maybe they may use some antihistamines to relieve the cold. In homeopathy, we use medicines like aconite, belladonna, bryonia, allium cepa, sabadilla, and such kind of medicines to relieve the congestion which is there. The general management can be that keep yourself hydrated, avoid yourself from exposure to sudden variation in temperatures, like see that you are not getting exposed to too much heat, too much cold. If you wash your hair, see that it is properly dried. Don't expose yourself to very cold winds. This is what you need to do. Keep yourself warm, have warm food. That should help you. Urinary tract infection in teenagers is a very common condition because they don't drink enough water, or they resist the urge to urinate, or they may not take care of the hygiene. There are three types of infections that can happen in the urinary tract. One is of the urethra, causing urethritis. The second is of the bladder, causing cystitis, and of the kidney, causing nephritis. Now the one which affects the kidney is the most dangerous variety, where the patient may have extreme abdominal pain, nausea, vomiting sensation, and feverish feeling, chilliness, all those symptoms. So that requires immediate medical attention. Even the other conditions require medical care, but whenever the kidney is affected, as we all know, that it requires more serious attention in that condition. Drinking a lot of water is the solution to this. Keep drinking water. At least 3 to 4 liters of water in a day is important when you have urinary infection, or more. More also should be fine. But make it a point to drink a glass of water every 2 hours. See that the hygiene is good. Don't resist the urge to urinate. The urinary infection can also happen because, if, for example, in children, what happens is when they have worm infestations and they don't clean the anal region properly after defecation, then the organism from the anus can spill over to the genitals, causing urinary infection. The size of the urethra is small in females.
Ladies and gentlemen, welcome to the journey of honor, journey of pride, and journey of celebration with Brand Icon presenting International Excellence Award 2018. On 28th evening, get ready to dress up in the shades of dark, as it is night to be get honored.
The next award.
Ladies and gentlemen, we welcome you all to International Excellence Award 2018.
So thank you for having me. I'm really honored to be presenting these awards. Thank you, Brand Icon, for inviting me.
The best homeopathy clinic in Bangalore, and the award goes to Amrita Homeopathy. Can we have Dr. Sanjay Panikkar?
Yes, can we please hear it for Malaysia, everybody, and International Excellence Award, and the whole team of Brand Icon.
Congratulations.
Sir, we're more than obliged for this great moment to happen to all of us, and yes, it's going to be Malaysia.
And hence hence the urinary infections can be common in women, especially small girls. And so it is important to take care of the hygiene, and if the hygiene is taken care of, many cases of urinary infection can be avoided. The very common remedies in homeopathy that we use for controlling urinary infection is Apis mellifica, Cantharis, Staphylos aureus, Sarsaparilla, and a few other remedies. Lycopodium is another very important medicine. So these medicines can be used to control urinary infection. Thank you. Fluctuating hypertension is a very common problem in people above 50 years of age. The average blood pressure should be about 120/80, the systolic being 120 and the diastolic being about 80. Whenever the value goes above, systolic value goes above 140, or if it is below 110, then it's a problem which needs attention. Whenever the diastolic value is, which is an average of about 80, goes up above 90 or below 70, that also requires attention. But in elderly people, generally above 50 years, you find that the BP can be fluctuating very badly, like the systolic can go high, 140 can become 160, 180, and the diastolic can go down, it can go up to 60 also in some people. So when you give medication, the medicine should be given very cautiously. In homeopathy, we usually treat this with symptomatic treatment, which I believe is the best treatment. There are medicines like Rauwolfia, which is used in hypertension, which I would advise to use it with caution, because these are plant extracts, of course, but then it is in crude extracts. Rauwolfia mother tincture is a crude extract, and so it has its impact on the body in long-term medication. So I would generally prefer using potencies like 200 or 30 potency depending on the symptom. Like for example, I had an elderly person who was vomiting continuously, and he had chills. He was my neighbor, so they just called me around 2 o'clock or 3 o'clock in the afternoon. I went and checked him up and found that his BP was very, very high, and this was because the medicine that he was prescribed was not taken on time, and his BP was, he had gone very high. He was vomiting, he had blurring of vision, and when I checked him up, I found that his posterior part of the tongue was coated yellow, and he had chills, feverish feeling, vomiting continuously. These were typical symptoms of Nux vomica, and after prescribing Nux vomica 30, I found that the BP dipped to a normal within half an hour. So the treatment usually for hypertension is a symptomatic treatment in homeopathy. The other medicine which I had used very successfully was Ipecac, where the patient had nausea, vomiting, high BP, and the BP was so high that the value went extremely, that lady had vomiting of blood also, and it came down within half an hour with Ipecac. When we speak about tuberculosis, most people often think of a person who is coughing continuously with maybe blood in the sputum, as it is shown in a lot of movies. But that is not the only tuberculosis. There is a condition of bone tuberculosis too. Lung tuberculosis, bone tuberculosis, various organs can have tuberculosis, like uterine tuberculosis. In all these conditions, one of the key symptoms which will give us an idea about whether this particular patient is having the condition or not is, first symptom is a weight loss. If the person is losing weight, having low grade fevers towards the evening, and his ESR is elevated to the level of 35, 40, 50, 60, then we must consider that possibly he has a tubercular condition. Send for a Mantoux test, and if this combination is positive, then you can say that he has tuberculosis. In certain patients, a tubercular gold test is also required to confirm whether the person has tuberculosis. Now once you identify this, it's important to be on regular medication. In allopathic medicine, as per WHO, there is a particular regime which is prescribed, a continuous medication for 6 to 9 months, and the patient has to be very regular to follow this. Irregularity in the medicine can lead to drug resistant tuberculosis, which is becoming very common nowadays. because people are not regular. They don't follow the course completely. In between, they break the course and again. So gradually the immunity which has to develop does not develop, and the organism becomes resistant to the medicine. But when such conditions are happening, the organism is becoming more and more resistant. That is where your immune system plays a role. And there is nothing like an immune system which can protect you. No medicine can give you as much protection as your own immune system. And hence, it is important to build up the immunity. There are medicines in homeopathy which builds up the immunity. There was a patient of mine who had repeated tuberculosis. Every time she's on a course, she is better, and then it keeps happening. And she's on medicines for almost 7-8 years, again and again. How long this patient is going to be on medicines? So that's when she started homeopathic medicine. Within 2 years, this patient is out of tuberculosis. That is the wonder of homeopathy, and we are able to cure cases like this with excellent homeopathic remedies if the patient is willing to go in for a homeopathic course. Then we can wonderfully treat these cases and bring them out of tuberculosis. One thing we all know about is that when we are on a lot of allopathic medicines like antibiotics, there is an extreme weakness which people experience. Here what happens is that the antibiotics kill the bacterial flora inside the intestines, and due to that the patient's absorption of nutrition and things reduces. Subsequently, a lot of weakness comes up. So it is important to supplement the bacterial flora which is required for absorbing the nutrition to see that there is absorption and assimilation. So Lactobacillus sporulac is generally used for patients when they are on a lot of heavy antibiotics, so that this useful bacteria is maintained in the intestines. Along with that, in allopathy, usually we give medicines like Nux vomica, which helps to reduce the bad effects of the allopathic medicines and helps the patient to come out of the weakness also. When there is typhoid, there is inevitably going to be weakness because there are certain patches which are formed inside the intestine called as Peyer's patches. When Peyer's patches come up, automatically the patients experience that the absorption of the nutrition is reduced, and so they develop this kind of a weakness. So what we do is we treat that particular patient based on the symptoms. There are several medicines which covers this weakness subsequent to typhoid. Bryonia is one of the medicine which is used not only in typhoid but also post-typhoid weakness. We also have major remedies like Avena sativa, which is useful for reducing the weakness of typhoid. Carbo, which is used when patients have a lot of gas formation, especially in the upper abdomen, and the patient feels better by passing gas a little bit. He passes gas upward and he feels a little better, and again he forms the gas and again he is feeling uncomfortable. He passes again a little and he feels better. Carbo, which is a remedy that gives relief for that. Again, we have another remedy called as China, where there is bloating of the abdomen. After major illness like typhoid, the whole abdomen is bloated and the patient is not getting any relief by passing gas up or down, and there is extreme weakness. China is one of the major remedy for this particular group of symptoms. So like that, based on symptomatology is what homeopathic medicine works. Muriatic acid is again one of the medicine which is used for extreme weakness. So these are some of the medicines which is used post typhoid weakness. There are several other medicines like Arsenicum album is an extremely good medicine for weakness. The characteristic here is that the patient is very restless, turning, tossing. The discharges are very, very offensive the minute you get into the room of the patient, or when the patient is passing motion, he feels that the motion is very, very offensive, and thirst for small quantities of water at frequent intervals. These are some of the characteristics which guide us towards giving Arsenicum album. Clinic in Bangalore. Pre-diabetes is a condition where the patient is finding that the blood sugar is somewhere in the borderline and he has a few symptoms of diabetes. The sugar is not high enough to call it as diabetes. Like for example, many people do face symptoms like they are either feeling too hungry, too thirsty, or they have to go for urination very frequently. But when you check the blood sugar, it is not that high also to call it as diabetes. Normally, fasting blood sugar of 100 to 125 is considered as the range for pre-diabetes, and when the value is higher than that, then only we categorize it as diabetes. Same way in the HbA1c test, which gives an average of 3 months. In that, a value of 5.7% to 6.4% is considered as pre-diabetic. So whenever the values are like this and you find that the patient has symptoms, we usually categorize it as pre-diabetic. And pre-diabetes is just a kind of a warning for the patient that you are heading towards diabetes. So you need to do something about this particular condition. This is a stage where the patient can definitely correct himself and thus prevent himself from developing into a full-fledged diabetic patient. So for this, he has to take care of certain things, and it is surely reversible and surely curable, you can say. Like for example, the most common reason why people develop these kind of symptoms is because of a bad lifestyle. Either they are not exercising, they are not eating the right kind of food which is rich in fiber, or they don't have enough sleep, they are too stressed out. These are the most common reasons. So if you correct these 3-4 things in your lifestyle, either eat well, exercise well, sleep well, and cut down on your stress with simple relaxation techniques, maybe yoga, pranayama, all these kind of techniques, most of the patients do find that their blood sugar dips. They don't even need medicine sometimes. But in certain patients, maybe medical intervention may be needed, especially where this is strong family history. When there's a strong family history, your pre-diabetic status is a little thing which you should take care about, because most of these patients with a family history can head towards diabetes. So this extra care with diet, exercise and de-stressing, all that is important. Along with that, certain homeopathic medicines also can be combined so that they can be completely out of diabetes. I have many patients who were in the pre-diabetic stage and have then taken a little bit of homeopathic medicine and then had all this care which I told, and they are totally out of it. Past 4 years, 5 years, their sugar is perfectly normal and they are maintaining it. So I don't think there should be any problem that if you take care of your lifestyle and diet. Infertility. The medicines for thyroid are started when thyroid is not functioning properly. Either it can be a poor function or it can be an excessive function of the thyroid. Poor function leads to reduced thyroid hormones T3 and T4, which are produced by the thyroid gland. Excessive function of the thyroid can lead to increased values of T3 and T4. Whenever the thyroid is not functioning properly, T3, T4 in the body reduces and pituitary gets a message. Pituitary is the master controller of all the glands in your body. Pituitary gets a message saying that T3 and T4 is not being secreted adequately by thyroid gland, and so it starts increasing thyroid stimulating hormone, that is TSH. When TSH starts going high, it stimulates the thyroid and thus T3 and T4 comes back to normal. This is the usual mechanism. So when you do your blood test, you will find your T3 and T4 is normal, but your TSH is elevated. This condition is called hypothyroidism. The same way, when the thyroid is functioning excessively, T3, T4 elevates, then pituitary gets a message that thyroid is releasing too much T3 and T4, then TSH goes down, and when TSH goes down, thyroid is not stimulated, then T3, T4 comes back to normal maybe. So you will find in your reports in many cases that T3, T4 is elevated and your TSH is low. So this condition is hyperthyroidism. So when you're on allopathic medicine for either of these conditions, it is that either to reduce the function of the thyroid gland or to increase the function, supplement thyroid with the hormone. There is no medicine to directly elevate the function of the thyroid gland as such in allopathic medicine. So they would start you on supplements like thyroxine or Thyronorm or Eltroxin. These are the brand names which are available. It is nothing but artificial T3 and T4. When you give artificial hormones, your body feels that thyroid itself is secreting T3 and T4, and so it brings back the TSH to normal. So you will see your blood levels are normal as long as you are taking these artificial tablets. The minute you stop your artificial hormones, if thyroid is not able to secrete those T3 and T4, then you will see that again the problem relapses. So in such patients, we can never stop artificial tablets. But let us say you have started artificial tablets T3 and T4. In the meantime, your body itself has made a corrective action and corrected the function of the thyroid gland. Then T3 and T4 comes back to normal because the thyroid itself is secreting it. And then in such a case, even if you stop your artificial tablets, you may not face too much of a problem because it will not relapse because thyroid has taken over. The same way, in excessive function of the thyroid gland, if your medicine has been controlling the function of the thyroid gland and everything is normal, and at that point of time, if you stop, the thyroid which was excessively functioning is still not corrected, it is still functioning, it is just kept under control with the other tablets. So the minute you stop it, there is a possibility of it increasing. But at the same time, if the body has rectified itself, then it will not relapse back. So the stoppage of thyroid medication depends upon whether your thyroid has taken over its function or not. Many children don't put on weight even though they may be fed every 2 hours. Parents often become very anxious. We need not consider the child to be underweight unless their weight is grossly below normal according to their height. Generally, there is a scale which says that okay, this much height the child is there, so this much weight the child should have. So let us say the child's height and the weight proportion. If the weight of the child is 20% less than what it should actually be at that particular height, then only we can consider that to be as an underweight. And it is only then we need to deal with this particular situation. If the child's weight should be 20 kg, 20% reduction in the weight than the actual weight that the child should have is only considered as a lower weight for that particular child. And hence otherwise the patient's parents did not get upset about it and we did not do too much about it. But let us say the weight is less than 20% of what it should actually be. Then you need some kind of treatment to improve the absorption and assimilation. So very often it happens in premature children that you feed them so well, yet they don't put on weight because they are premature babies and their body has not grown in proportion to what actually they should have grown. So their requirement is higher. So there you must feed more frequently. And yet if it is not putting on weight, it could be a problem with the assimilation, absorption and assimilation. So there homeopathic medicines play a role. Medicines like sanicula, abrotanum, iodum, natramur, tuberculinum are excellent remedies in this kind of a condition where they don't put on weight despite eating well. Everybody would like to have beautiful pink lips because pink lips are said to be the sign of beauty, and so there are some secrets to have pink lips. Some of the reasons for why the people's lips can get darker is medically known. For example, anything that you apply or come in contact, anything that which comes in contact with your lips can lead to a change in the color of the lips. For example, the weather, humid weather can cause darkness of the lips. I mean, if you are exposed to very hot sunlight, then you can have dark lips. Again, like too much of tobacco smoking, tobacco chewing can cause dark lips. At the same time, even for people who have some skin problems, or if you have less oxygenation to the tissues, like as in anemia, you can have dark lips. Using too much of cosmetics like bad lipsticks can cause darkness of the lips. If you leave the lipstick overnight and don't wash off at the end of the day, then that can also cause darkness of the lips. Even certain medication can cause darkness of the lips, like as in chemotherapy can cause darkness of the lips. Too much of fluoride in your toothpaste can cause darkness of the lips. So these are some of the factors which can make your lips darker. And if you want to make them pink, there are some simple methods which you can follow. Like the most best thing in nature which can make your lips softer and little pinker is the cream of milk. Usually you can apply it over the lips at night, let it stay for about half an hour to 45 minutes and then wash it off, or maybe you can even let it stay for 1 hour. But don't let it stay overnight and sleep off with that.
Ladies and gentlemen, welcome to the journey of honor, journey of pride, and journey of celebration with Brand Icon presenting International Excellence Award 2018. On 28th evening, get ready to dress up in the shades of dark as it is night to be get honored.
The next award.
Ladies and gentlemen, we welcome you all to International Excellence Award 2018.
So thank you for having me. I'm really honored to be presenting these awards. Thank you, Brand Icon, for inviting me.
The best homeopathy clinic in Bangalore, and the award goes to Amrita Homeopathy. Can we have Dr. Sanjay Panikkar?
Yes, can we please hear it for Malaysia, everybody, and International Excellence Award, and the whole team of Brand Icon.
Congratulations.
Sir, we're more than obliged for this great moment to happen to all of us, and yes, it's going to be Malaysia.
Then you will have ants crawling on your lips. So the other thing that you can do is crush these rose petals, and you can mix it with the cream of milk and apply it on the lips. That also can make your lips pink. Even you can have very good remedies, aloe vera juice. You can mix it with raspberry. You can mix it with almond oil, and that can be applied on the lips. And all these berries are said to be good to make your lips pink. Then we have turmeric and milk paste, which is another remedy, home remedy, which you can apply on the lips, and it can make your lips pinker. If you rub a little bit of lemon juice with sugar on your lips and let it stay there for about half an hour and then wash it off on a regular basis, that also is useful in making your lips pinker. Cucumber can also make a thin slice of cucumber and rub it on your lips for about 15 minutes, and that also is said to make your lips pinker. These are some simple methods which can help you to turn your lips into beautiful lips. Increasing the height in boys in their early 20s is possible to an extent, but again it is depending on the genes or the genetic factors in the background of the patient. Height is determined by a gene which is there in a particular person. Usually in boys, the bones ossify by 21 years. And after the bones ossify, then it is very difficult to increase the height. So whatever height gain you have to do it before 21. Some patients, they have seen that even up to 25 years that the ossification happens. Might be a little slow in some people. So maybe 21 years or sometimes even up to 25 years you may be able to do something with regard to height. So to increase the height, the most common thing that anybody would think of it is to eat well, sleep well. It is noticed, there is a research done where they say that everyday morning, even you can check it yourself, when you wake up in the morning, check your height. When you go to bed, check your height. Your height would be a few centimeters more in the morning when you wake up. That is because the body would have stretched, the vertebrae would have aligned, and so there is a slight increase in your height. So the posture of the person is again very important in deciding how your vertebrae is aligned, and so your height can be up by a few centimeters. Sleep well and the body heals during sleep. If you sleep well, 8 hours minimum, it helps the body to grow well. Eat well. A nutritious diet, especially high protein diet, rich in calcium, can also help you to grow taller. Drink lots of water. A minimum intake of 3 liters and if possible more than that should be there so that your body's toxins are flushed out and it becomes easier for your body to absorb the nutrients, and so the growth also happens. Again, everybody knows that we need to exercise. Exercise is the most common thing which can help you to grow taller, and the very easy thing is that catch on to something and hang. So when your body stretches, the chances of your height increasing is a bit higher. Your bones can grow longer because that is the time when ossification has not yet happened. So as the muscles stretch, the pulling happens and so the traction is there, so the bones can easily grow longer. So stretching exercises are the best exercises. Running, jogging, cycling, swimming, all these things are also very good to improve on your height. There are homeopathic medicines which can help you to increase height, and this should be started preferably in between your 15 to 20 years of age. And I have patients who come to me even later than that. So I usually don't encourage them too much unless the patient is very insistent and wants to give it a try, because they say that 21 years ossification happens, but in some patients it can get a little delayed. So that's why they just want to give it a try sometimes. So but otherwise, usually the best time to work out on your height is between 15 to 20 years. Excellent homeopathic remedies are there which can improve your height and see that you grow a little more than what you would otherwise be. Like for example, Calcarea phos, Symphytum, Arnica. These are some of the medicines which can help you to grow taller. Oleum jacoris aceli is another medicine which also helps you to grow taller. I often tell my patients that if you want to grow taller, see to it that you have adequate rest and you need to sleep well. Don't watch your TV in the night and sit. Instead, sleep before 12 and wake up early. Early to bed and early to rise makes a man healthy, wealthy and wise. Clinic in Bangalore. Smoking causes numbness because of one single factor, that is nicotine. Nicotine reduces the circulation to the different parts of the body by constricting the blood vessels through a process called as vasculitis, where there is inflammation of the blood vessel, and so the blood vessel constricts, the blood supply to the part reduces, and thus numbness happens. Usually the affected areas are the hands and the feet. This condition is called as thromboangiitis obliterans, or otherwise called as Buerger's disease. Usually in Buerger's disease, the initial stages there is not much pain, but as the time progresses, pain, numbness, paleness, blueness and coldness of the affected part often happen. Initially the pain is only on exertion, later on it even happens during rest. And because of the numbness, very often people do develop injuries because they are not aware of the sensation, and because of the injury subsequently there can be an ulceration. Very often allopathic doctors suggest that we should go in for a surgery if there is total obliteration of the blood vessel, total blood supply loss, so that we can produce collateral bypass surgery. If a particular vessel is blocked, then you can bypass that vessel and connect the blood supply to that particular area. So this is the usual line of treatment, but in homeopathy we may be able to avoid these kind of things. The basic first and the most important thing to stop in Buerger's disease is smoking. If you quit smoking, 90% of the cases improve with just that. Viruses causing numbness is because of the virus attacking the nerve. This condition is called peripheral neuropathy. When a virus attacks the nerve, that particular nerve tissue gets damaged, and hence the supply to that particular part becomes less and that particular part can become numb. But nerves are capable of regeneration, and hence this is a reversible condition in many cases. The most common condition where the viruses may attack nerve is the herpes virus, which affects the nerves due to a particular virus called as the varicella zoster, which is responsible for chicken pox. Usually herpes is a complication or a secondary effect of people who have developed chicken pox in their childhood. Very often this particular virus is said to be residing in the body itself in certain parts of the nervous system, and later on they become active at some particular phase and they affect the nerves, causing small eruptions which are very painful and burning and very difficult for the patient to deal with. Medicines can treat it, but it takes a lot of time to come out of this particular problem. Similar viral infections which can cause numbness are Epstein-Barr virus. Even the HIV can affect the nerves, causing numbness. So the different conditions. Most important thing to come out of this problem, you can say kind of tips to work out on how you can get rid of this numbness and the effects of neuropathy is eat well. Eat well, exercise well, sleep well. Have proper nutrition, because whenever the nerves are getting affected, nerves can be regenerated by sufficient multivitamin supplementation, B complex supplementation, and thus you can improve the condition. Again, keep yourself warm. Don't wear too tight clothing because that can compress the nerves, and keep yourself to avoid cold exposure. So this is the way in which you can see that your nerves are not getting further damaged or further affected and come out of the problem. The other thing that you must take care is that avoid smoking, avoid alcohol. Gentle massage to that particular area can also reduce numbness. The other techniques through which you can improve numbness is chiropractic methods, acupuncture and yoga. Thyroid is a gland in your body which produces two hormones, T3 and T4. Pituitary is another gland in the body which is the master controller of all the glands, which secretes thyroid stimulating hormone, which stimulates the thyroid, making it to release T3 and T4. So if the thyroid is functioning excessively, T3, T4 in the body starts increasing, and pituitary gets a message that thyroid is functioning excessively and it should not stimulate the thyroid that much, and so the thyroid stimulating hormone, that is the TSH, starts reducing, and in turn the thyroid is stimulated less and T3, T4 comes back to normal. So this condition where the T3, T4 is elevated and TSH is on the lower side is called hyperthyroidism. Normal TSH values range from 0.3 to 4.2. Though earlier days we used to consider 0.3 to even up to 5.5 as a normal range. But there are certain kits which are still available which quote 0.3 to 5.5 as the normal range. There are certain other kits in which the normal range is mentioned as 0.3 to 4.2. So if we find the thyroid values within this range, then generally from the medical point of view, we consider that thyroid is not having any major issue and it need not be treated with supplementation or with any medicines at that point. But let us say the value is a little bit too much on the lower side. Let us say your TSH value is less than 2, less than 1.5. Then most probably what happens in these subjects, a lot of them later on in life, we've seen that they turn on to hypothyroid subjects. That is, suppose your TSH is on the lower side for very long periods. Certain individuals, there is less stimulation of the thyroid and we find that there is less production of T3 and T4, and these people gradually can head to hypothyroidism. So in this condition, it is important that the patient should not start any medication but should take care about the diet. So this is what we need to do in these kind of conditions. Certain foods are goitrogenic, which can cause thyroid problems. Certain foods are not. So this you should be aware about. Cauliflower, cabbage, broccoli, processed food, preserved food and refined sugars are known to be not good for the thyroid gland. There are certain foods which are very helpful for thyroid, like cranberry, for instance, is very good for the thyroid functions. Especially it is useful in hyperthyroidism, where thyroid is functioning excessively. Salt containing iodine helps in hyperthyroidism. There are excellent medicines in homeopathy which can improve the function of the thyroid gland, like thyroidinum is one of the major medicines which is used, calcarea iode, sulfur iode, natrum iode, and all these medicines are found to be very useful in thyroid functions. Iodum and spongia are other two major medicines used in improving the functions of the thyroid gland. I've had many patients with thyroid problems where we have brought back the value to normal with just homeopathic medicines, where it has been identified with just homeopathic medicines. Even by examining the hair, you can tell whether this patient has got a thyroid problem or not. Whenever there is pain radiating from the left side of the chest and extending over to the left arm, the most important diagnosis that we must think of is possibly there is some cardiac issue. And the second most important thing is a cervical problem. Even a cervical problem can sometimes have a radiating pain down to the chest and down to the arm. So the other simple issues is hyperacidity, as it is seen in irritable bowel syndrome and gastritis, gastroesophageal reflux disease, which is another reason why this kind of symptom can develop. Whenever the pain is radiating down to the arm, rule out cardiac issues. If the pain is less than 5 minutes and it disappears after that, it could possibly be angina pectoris, and this is relieved by sublingual tablets like sorbitrate. This is one of the medicine which can be used to relieve angina pectoris. The other reason why you can have this kind of pain is a real heart attack, where the patient can have severe pain with profuse sweating, vomiting, and if you find that the patient is developed these symptoms after a food, after having a heavy meal, then possibly it is a heart attack, and so you should immediately, it just does not come down even after 15 minutes, is not relieved by any tablets, so then it requires medical intervention. Whereas pain which is related to the cervical, down, radiating down to the chest or to the arm, is a neurological pain, and it is usually caused by some bad posture, like for example, I had a patient who was constantly on the laptop and developed this. I had a teacher who was writing always on the board, and so she developed the pain down. So this way symptoms can be there. Also, if you have irritable bowel syndrome, then the gastritis can cause a referred pain along the nerve down to the arm. Nowadays everybody is looking at weight loss. Sudden weight loss in a young person may make him happy because he has lost weight without effort, if at all. But the most common reasons why we come across people losing weight suddenly is either he's on a crash diet or he's under too much of stress. So the easiest way to lose weight can be you have a fight with your wife, and probably you can lose weight more easily. So this to say on the lighter side. But otherwise, there are major health issues also which can make you to lose weight. Diabetes is one of the disease which can make you to lose weight suddenly without any specific reason, and so check your blood sugar if this happens. Tuberculosis infection can make you to lose weight, and also HIV is another reason why people can lose weight suddenly. Cancers, as you know, also causes people to lose weight. And simple problems like digestive issues, where the person is not able to absorb the diet that he's taking, the food that he's taking is not broken down properly, is not absorbed properly, is another reason why a person may lose weight. Like Crohn's disease, ulcerative colitis, conditions like this also, people may lose weight suddenly. Ulcerative colitis is a common condition which can lead to a lot of anxiety in the patient. It is very often seen in type A personalities. Type A personalities are people who are little systematic, perfectionist, orderly, meticulous, and wants things to be done in a particular fashion. So they're kind of a perfectionist kind of a person. In the process, they develop these kind of problems like ulcerative colitis. So control of the anxiety can also help to improve these conditions to some extent. But cure of ulcerative colitis is not that easy. It requires a lot of effort on the part of the patient and on the part of the physician. Symptoms can be of frequent stools, weight loss, mucus and froth in the motion along with blood. On endoscopy, then sigmoidoscopy, we can identify ulcerative colitis in the patient. Now, when you have this particular condition, treatment can be symptomatic. It can be that we use remedies like mercury. Merc salt can be used when there is excess of blood in the stool and less of mucus, and Mercor can be used when there is more of mucus in the stool and less of blood. In both these remedies, there is large flabby tongue with indented edges, excess salivation during the sleep, and all these symptoms are usually worse in the evening and towards the night. Other remedies that can be used in ulcerative colitis is arsenic. They are seen in perfectionist people, and two major remedies which is indicated in perfectionist is arsenic and lycopodium, and both these remedies can be used. Arsenic is a chilly patient, lycopodium is a hot patient. Lycopodium has more of gastric symptoms, especially worse between 4 to 8 pm. Arsenic symptoms are usually worse between 1 to 2. Lycopodium symptoms between 4 to 8. That's again a major differentiation. And we can also use remedies like Thuja in ulcerative colitis. Thuja usually has an urge for motion immediately after eating. So that is again an indication. So if you find these indicators, then you can prescribe these remedies. But it's always better to take a physician's advice than to do self-medication.
Ladies and gentlemen, welcome to the journey of honor, journey of pride, and journey of celebration with Brand Icon presenting International Excellence Award 2018. On 28th evening, get ready to dress up in the shades of dark as it is night to be get honored.
The next award.
Ladies and gentlemen, we welcome you all to International Excellence Award 2018.
So thank you for having me. I'm really honored to be presenting these awards. Thank you, Brand Icon, for inviting me.
The best homeopathy clinic in Bangalore, and the award goes to Amrita Homeopathy. Can we have Dr. Sanjay Panikkar?
Yes, can we please hear it for Malaysia, everybody, and International Excellence Award, and the whole team of Brand Icon.
Congratulations.
Sir, we're more than obliged for this great moment to happen to all of us, and yes, it's going to be Malaysia.